The CDC today released some new distancing guidelines that should make it easier to get kids back to school. CDC Director Walensky now says studies show that when children are masked, 3 feet of distance is enough to keep them safe, as kids have a lower transmission risk than adults. Now, that 3 feet could make all the difference for some schools that don't have enough space for those 6 feet of distance. Let's bring an emergency physician and ABC's medical contributor, Dr. Darian Sutton, and economist Emily Oster, who's been gathering data on COVID in schools throughout the pandemic, to break this one down for us. Good afternoon to you both. Thanks for being here.
Good afternoon.
So, Dr. Sutton, I'll start with you. Can you just explain why 3 feet is now considered safe for kids as opposed to the 6 feet that we've always heard for adults?
Yeah, so this recommendation comes from new data that is emerging, most recently a study from Massachusetts that basically compared schools that did the 3 feet rule, where they kept students 3 feet apart, as well as schools who kept students 6 feet apart. And what they found was that there was no significant difference in the infection rate or spread. And so that led to them establishing this rule. Now, with that comes some caveats. Most notably, masks should be worn at all times. And it also differentiates between elementary schools and middle school and high school. Right now, elementary schools are allowed to keep that 3 feet distance regardless of community spread. And the current recommendations right now for middle school and high school is that that might need to increase if infection rates in the community increase.
And Emily, I guess about 2/3 of all American public school students have access to in-person learning of some kind. About 40% have access to all-day in-person learning. But obviously, that leaves a lot of students who are in school districts that have not gone in that direction. So how does this new finding make a practical difference for some schools?
So I think this will make a practical difference to a number of schools that have been forced to be in more hybrid part-time modes because of these 6-foot distancing requirements, that for some schools, they simply don't have the space to get everybody in. And when we allow them to distance children at only 3 feet, they may be able to move from a place where, say, kids go to school 2 days a week to a situation in which kids can go to school 5 days a week. And I think that is going to hopefully be good for kids in terms of getting their learning back on track, getting them back in the classroom, interacting with others.
Absolutely, because the cost to those kids and to the wider society is very high. Dr. Sutton, so the CDC, however, says that adults in school settings need to continue to keep those 6 feet of distance from one another. For people who might wonder, well, why? Well, why kids 3, adults 6?
I think that this is to acknowledge the level of risk. From what we know right now in the past year or more than a year of fighting this pandemic is that children, especially those under the age of 16 and 18, are less likely to become infected, to become severely ill, and to transmit the virus. However, adults are not immune to that. And so I think these rules and this guidance was put in place to protect the teachers and make sure that they are staying that appropriate 6 feet apart while wearing masks to decrease the possibility of transmission as much as possible.
And Emily, you said this week that an unvaccinated 9-year-old has the same risk of getting COVID as an elderly person who is vaccinated. Can you explain the data behind that and what overall takeaway you hope people get from making this point?
Sure. So just to be clear, what I wrote this week was that in terms of serious illness, hospitalization, death risk, children have much lower risks than adults, comparable to as if the adult is vaccinated. In terms of case risks, children actually are not like vaccinated grandparents. They can still get infected. They tend to be lower risk. As we get more herd immunity, I was particularly thinking about the summer, as we have high vaccination rates, as we get to a place where all adults are vaccinated, then children will be protected by some of that herd immunity, along with their own low risk of serious illness. And then when we start thinking about operating the summer, we don't necessarily need to leave kids behind as adults are interacting. So it's not now, and it's also not that kids don't get COVID, but simply that they're less likely to get seriously ill.
And Dr. Sutton, a lot of places it's become a political issue. From a medical perspective, what do you think are the costs to children? Have there been significant costs to children of not being back in school? Do you see that?
Absolutely, Terry. I have to say that personally, from my own personal experience with my family of family members who are currently in elementary education, the cost is true and real. Many students need that social interaction. Many students need that form of housing during the day while their parents work. Many students need that formal level of education that can't be done at home. So I think in many cases, we've seen students becoming more anxious, more signs of clinical low-level depression as students aren't able to interact in the way that they normally would before the pandemic. So hopefully these changes will allow students to get back into school, have these important social interactions and this formal level of education, but also while remaining safe.
All right, Dr. Sutton and Emily Oster, author of Expecting Better and Crib Sheets, we appreciate your time today. Thank you both.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.